Hi everyone, Tony Maritato here, physical therapist, Middletown, Ohio. So I've got about 3 of 20 of my favorite little devices, tips and tricks that I want to share with you today to help reduce pain, reduce swelling, and get you ready to do your home exercises. Because nobody wants to, and nobody should be trying to push through the pain to gain range of motion. If it's painful and getting more painful, something's wrong. Talk to your physical therapist, talk to your surgeon, figure out what's going on. The home exercises, they might not be enjoyable, but they absolutely should not increase your pain. Now these little tips and tricks, 3 of them, they're gonna be designed to be low cost, easy to use, safe to do at home. So let's just jump into it. The first thing is ice. And I've got to say, I love these ice packs. Now I've got a whole video on ice, and I'm the first one to admit, based on research, ice is not a requirement. So if you don't like ice, if ice makes the pain worse, if ice makes you feel bad, don't worry about it. It's not necessary for tissue healing. There's some people that believe icing the injured joint might actually slow down or compromise healing. So the jury is out, but I would say for the majority of people, ice is cheap, it's easy, it's an effective way to reduce the subjective feeling of pain. So if you like it, use it. If you don't like it, don't use it. In this scenario, I'm going to show you how I use it along with other methods. The second little tool we're going to get into, and you guys have probably seen dedicated videos on this, is just a little compression. Now I like compression with ice. It feels good, it's soothing, it's relaxing, it numbs the joint, it reduces the pain. But again, if you don't like the ice, eliminate the ice. If you like the ice but you don't want to do compression, no big deal. If there are some vein issues or concerns that you have, if there's some venous return issues that you're worried about, consult your physical therapist, your surgeon, talk to somebody about it before you do this. I'm more just sharing the ideas. So you have some, direction. You can say, hey, well, what do you think about this or that? And then the last one is a TENS unit. And we've talked about TENS units before. TENS is purely for sensation. It's not going to heal. It's not going to increase tissue healing speed. It's just to feel something different, to give your brain and your nervous system a break from the pain, feel something else, and kind of provide that distraction while you're exercising, after you've exercised, before you're exercising. Anytime is fine. But again, you have to make sure you're medically cleared to use a TENS device. A TENS device is a medical piece of medical equipment, so make sure there's no cardiac concerns, make sure there's no pacemaker involved or other issues that might limit you from using a TENS unit. But I'm going to show you today how to put all 3 together into kind of a cocktail that's going to be, for the right person at the right time, it's going to be really effective in reducing pain. So let's just get started. Enough talking. I'm going to grab just a regular pillowcase. Typically, for our clients, you can put ice directly on the skin. You're not going to have any problems, but for comfort, we usually just put it into a thin cotton, clean pillowcase. There we go. Now these ice packs, you can buy them on Amazon. They're like 20 bucks. They last forever. You've probably seen the light blue. You've probably seen the clear packaging with the blue gel. These black neoprene, they cost about the same, maybe a couple bucks more, but they are incredible. This thing has been in the freezer more than 24 hours. It's still soft and compliant. I can squeeze it, but it stays really cold. And that's the important part. All right, let's see, where do we begin? So let's begin with the TENS unit. If you have a TENS unit, awesome. If you want to pick one up, they're selling them on Amazon for around $26. You can get some extra electrodes for another $5 to $10. But let's check it out. So these TENS units, more expensive doesn't mean better. So I typically go with what's called an analog TENS unit. They have some digital ones that are just a little bit more. It runs off, let me see if I can get in here close. It runs off a regular 9-volt battery. Now, the settings here on the frequency and the pulse rate, The pulse width and the pulse, the pulse width and the pulse rate are really up to you in terms of how you want to set them. I set them for comfort, right? So for me, pulse rate, I like it between 70 and 120. For pulse width, I like it between 120 and 180. Just to give you an idea, I'm not sure that the camera can pick it up. So when we turn it on and you see that light, if I mess around with some of these settings, let's see if I can turn that, fat fingers. Okay, so you can see how now it starts blinking, and then as I turn it up, it speeds up. So basically what that's going to be is what the sensation is of the electricity. It's either going to be more of a pulsation type effect or more of a constant steady buzz. So you guys set it to what feels best for you, but for today, I'm going to leave it at 70 and 150. Typically, you keep these closed unless you're changing the battery. There's nothing for you to do inside the casing. All right. Every TENS unit will come with a pair of leads. Leads are the wires that have the red and black terminals. And so they really keep these simple. The lead wires plug in. There's no right or wrong side to put them on. You just put them wherever they fit. In this case, on this unit, they fit right on there on the two top sections. Each lead wire ends in a red and black terminal. The electrodes, now these are what we call 2x2. You can also get a 3x2, which is a little longer. The bigger the pad, the more comfortable typically it is. So basically what you're doing, you're going to come in, you're going to attach the wires. It doesn't matter which wire goes to which lead. I'm trying to do this a little bit quickly, and that's why I'm fumbling around with it. Once I get all four lead terminals in, now let's take a look at this. So I've got my ice pack. Typically, you might be on a couch, you might be on a bed, wherever you're going to be doing this. And let's just say, here's my surgical leg. I've got my incision through the center. I'm going to attach the leads in a series of different patterns until you find the pattern that works for you. So the most common, I take one wire. This has my red and my black. I'm going to put one inside below the knee, one outside above the knee. I try to find fleshy areas that they'll stick to. Straight over the bone, not really the way we would normally do it. And then I just do the opposite on the other side. Now I will tell you that right here on the outside of the knee, if you can see that, the fibula runs along the tibia. There is a bundle of nerves right out here. It doesn't usually feel good to put it right on top of that bone and those nerves. So I usually put it a little bit lower, and then I'll come on the inside of the inner thigh. So these two guys are crisscross, right? So I've got one wire going this way, I've got one wire going this way. Certainly, I could try some work behind the knee, just any kind of pattern. You just experiment and see what works best for you. Now what I'm going to do is I'm going to click it. So now it turns on. You can't see it from there, but that little light is going. I'm going to turn it up to a comfortable sensation. I can just start to feel that buzzy, tingly feeling. It's comfortable, it's not painful, my muscles are not twitching. Then I grab the other side, click it on, and then I start to take that up to again match what I felt on the first wire. So right now, it's a comfortable, buzzy sensation. No muscle twitching, no pain, no discomfort. Feels like a vibration almost. So once I've got this set to the level, the intensity that's comfortable for me, and some days it might be higher, some days it might be lower, what I'm going to do is I'm going to grab my ice pack. Now this is an oversized ice pack. I can't remember. There's a standard size, there's an oversized, there's ice packs for the neck and ice packs for different parts of the body, but this is just a regular oversized ice pack. I contour it to the leg, and so this is the bottom and this is the top. If I was dealing with more issues on the back side of the leg, Baker's cyst, things like that, I can certainly put it underneath. But generally speaking, most of my clients complain of symptoms either below on the inside of the knee or on the outside of the knee. These are the two most common areas. So with that, now I've got the TENS unit running. I've got the ice pack, which would be called cryotherapy. And now what I'm going to do is I'm going to grab my handy dandy ace wrap. Now these are 6-inch wide ace wraps. I recorded a video not too long ago showing you how to do a compression wrap, a gradient from the foot all the way up into the thigh. It usually requires 2 of these. I do not like the 3 or the 4-inch wide wraps. I would only get the 6-inch wide wraps because you want that kind of coverage. Now typically, you know, it's easy for me to lift my leg and start wrapping it because I didn't have knee surgery and I don't have swelling and I don't have pain and all the problems that you're going through. It's not so easy for you, and I understand that. So what we're looking for is if you are stuck by yourself, you need some way to get that leg elevated, and usually it's going to be something like a stack of pillows. So what I'm going to do here is I'm going to come in, I'm going to grab those pillows and put it under the leg. So right now there's space underneath where my knee is. I'm going to grab my wrap, I'm going to come down below the ice pack, and I'm just going to do a straight spiral at a comfortable level of compression. So I feel a little bit of a squeeze, but it's very, very comfortable. I don't feel any throbbing or aching or soreness. When we talk about wrapping, what I try to do is if this is a 6-inch wrap, I try to overlap 3 inches with every spiral around my leg. When I come to the end, I grab my second wrap. Let's get this guy out of here. I do not like these little metal clips just because they can dig into the skin and sometimes you don't even realize it and you develop a wound because of it. And so I continue to wrap. The wires of the TENS unit are just right under there. You won't even notice them. Now I like to take the wrap as high up into the thigh as possible because at the end of the day we want that swelling and that fluid to get back into the system and be processed by the kidneys. I've got an awesome interview with a therapist who specializes in lymphedema. And what I'll do is I'll post that video. If you look up here, something's gonna slide out. That'll be the video interview with that therapist. All right, we're almost done. So I've got my TENS unit running. I've got my cryotherapy, my ice packs on the leg. I'm gonna flip this around lengthwise, get my junk out of the way, pretend you're on the couch, pretend you're in bed, wherever you are. And then I'm gonna lay back and relax. Now, I'm out of bed here, so don't slide down. But the idea here is, you know, so now I should be able to comfortably remain in this position 10 minutes, upwards of 20 minutes. If I was really struggling with swelling, what I would encourage is folding these guys over, getting a little more elevation and trying to have my body flatter, like this pad is inclined. Not really the best to get that high. I would ultimately want that leg about 45 degrees at the hip so that the fluid has gravity assisting to come back into the system. A couple questions that always come up. Well, it's too uncomfortable to have this kind of knee extension for 10, 15, 20 minutes. Is it a problem if I put a pillow under the knee? So while this is absolutely going to be more comfortable, Some physicians, some surgeons, some therapists are going to say, no, you're never allowed to position yourself with the knee bent like that because you're going to get a contracture, the scar tissue is going to form. I think you have to take the entire context, the big picture into account. My question would be, if you're not working on knee extension beyond this, if you're sitting in a chair 8 hours a day and the other 8 hours a day you're laying in bed with your knee bent, and the other 8 hours a day, you're just sitting comfortably with the leg bent and you're not doing any extension exercises, I would agree. Probably concerning, probably going to have problems with getting your extension. But if you're laying like this for 10, 15 minutes with the leg propped in a comfortable position with the goal of reducing swelling, reducing pain, so that when you're finished with this, you're going to go do your extension exercises. You're going to stand and do your toe raises and all that kind of stuff. Do not worry about the 15 or 20 minutes in a comfortable position. Just like you need recovery from exercise, recovery is when you get stronger. Exercise is when you get weaker. Just like you need recovery when you take a vacation from your job. We all need that break. I would say this is kind of the same thing. This is your break from the work of improving your range of motion, gaining strength, gaining function. So this really should be comfortable. I can feel the coldness. It's not burning, it's not throbbing, it's not aching. I can feel the compression. My toes are not numb, my toes are not tingling. All in all, it's pretty comfortable, and it should feel soothing, and it should feel relaxing. And you could almost fall asleep. And if you did, it's not a big deal because the TENS unit's going to turn off in 15 minutes. The ice is going to continue to warm because of your skin. And then the compression is just going to work on getting that fluid back into the system. So guys, this is just one of many, many different ways that you can work on reducing pain, reducing swelling, increasing function. I'm going to do my best to get you some more examples, get you some different little tips and tricks, but if you like this video, if you feel like this content is helpful, post a comment on the YouTube channel so that I can see exactly what you want to hear more about. Because if you ask me questions, I can produce better content. Other than that, all of the links for these materials and products are in the video description. Nothing should be more than 25 or 30 bucks, so it should not break the bank. But let me know what you think. Let me know, give me a thumbs up. If you're watching it, if you like the videos, subscribe to the channel. Otherwise, I'll catch you on the next video. Thanks for watching.